This is the unfortunate part. We don't have a lot of treatment options for women. And if you look about it, if I want to give you an example, in 2015, if you and I went into the drugstore in the US, Walgreens, and said, give me all of the drugs to treat women, treat men for sexual dysfunction, they would put 30 drugs on the counter. These are all the wonderful treatments for men. In 2015, there was not a single FDA-approved drug to treat women for any sexual dysfunction. Very sad. In 2015, the first drug to treat women for female sexual dysfunction came out, and it was called Addyi or Flibanserin. And Flibanserin basically is a drug that a woman takes every day and increases her desire for sex. That's it. That's the FDA indication. Increases her desire for sex. Several years later, the second drug for women came out. This was called Vyleesi or bremelanotide. Essentially, it's an injection that she takes 45 minutes prior to intercourse, and it increases her desire for sex. But again, we have only two drugs. The reason being is because the research, the funding that we have for female sexual dysfunction is far less than we have for male sexual dysfunction. And it's unfortunate because, as I mentioned earlier, this is a couple's disease. And so many times I have to use drugs that I use for men to help treat women. So I do use Viagra for women, but Viagra for women helps arousal. So let me explain.